Stay home. If you have symptoms, you shouldn't be gathering or exposing other people to it. You need to stay home and rest and take care of yourself.
It's a simple message, right? We've been hearing from health experts since the pandemic began. If you feel sick, stay at home. But that's easier said than done. Many Americans face pressures to show up to work while we're sick. Dr. Elizabeth Eger is an assistant professor of communication studies at Texas State University and has studied this phenomenon. Welcome, Dr. Eger.
Thank you so much.
Thanks for joining us. Now, you actually gave this a name. You coined it and named it presenteeism. Can you explain a little bit more about what this is?
Sure. I actually didn't coin the term. What's exciting about it and important is that it actually comes from nursing. So nurses coined this term because what they were seeing is people showing up to work while sick. And we can think about in medical professions how that can be really dangerous. But it's this idea of showing up to work while sick, and that could be with a chronic health condition, so something you face regularly, or it could be something more acute like a cold, flu, or COVID.
Well, speaking of health professionals, they've always said, particularly during the pandemic, to stay home if you feel sick. Your study started before the pandemic and continued into it. What have you observed? What have you noticed more in people choosing to take care of themselves instead of clocking in for work?
So what was interesting about this research is that I actually started it before the pandemic and also conducting it during the pandemic to look at national experiences across occupations and across different identities, as well as different types of sick leave policies. And one thing we're seeing before the pandemic is that we know it can be a norm to come to work while sick in the United States. It's often something that our employers expect of us. It may also be something that we expect of ourselves. We don't want to let folks down. We don't want to get behind on a project or have a bunch of work to catch up on. Another thing before the pandemic that we saw is people who did have sick leave, which many Americans do not have sick leave, but those that do, it's often called paid time off. So they might want to save that for vacation time. My older adult participants were saving it for if they had a more serious illness down the road, or parents were often saving it for their kiddos. So that's sort of pre-pandemic. And then during the pandemic, what we saw early on are organizations actually creating more sick leave policies to protect their workers. There was also governmental funding available, especially for organizations under 500 people, to pay time off, and also just kind of a bigger collective care for others to say, hey, I need to stay home. I know this is contagious. I don't want to get my coworker or their immunocompromised parent sick.
On that train of thought, what more can be done about it so both an employee and employer can win and in the workplace?
Yeah, I think one thing that is really helpful is having a conversation about this word presenteeism. It becomes such a part of our culture that we don't think to challenge it. So sometimes as a communication expert, what I look at is having language for something can really make a difference. So talking about, hey, this is a problem in our organization. We really need to actually take time off if we're sick, if we have it. We need to create paid time off if that is not currently available, as well as create safe practices for those of us that have to be there in person as essential workers. So things like providing free masks for workers, making sure that they have time off to get tested if needed, those sorts of resources at the organization level.
Yeah, paid time off, that's certainly a larger issue. Dr. Elizabeth Eger, thank you so much. You're an assistant professor of communication studies at Texas State. We appreciate your time and for your discussion this morning.
Yeah, thank you. Take care.
You too.